Coming up on First Look Asia, rich Asian diets. Must the carbs be cut down to manage type 2 diabetes? A doctor checks in for Health Matters next.
Welcome to Health Matters. Now this morning we're looking at why carbohydrates matter to people with type 2 diabetes, the most common form of the disease. Many make the error of thinking that if you have diabetes you can't eat carbs, but that's not true. A diabetic can eat carbohydrates, but it's got to be the right kind. Well, to help us figure out the difference, we're joined by Dr. Ben Ng, an endocrinologist with Singapore's Mount Elizabeth Novena Hospital. Good morning, Doctor. Thank you for joining us this morning. Firstly, if you can start by explaining what is the connection between a person's carb intake and type 2 diabetes?
I think the intake between carbohydrate and type 2 diabetes, first of all, we need carbohydrates to live. I think that's something which has to be very, very clear about. So when people say, oh, when you're type 2 diabetes, you can't take carbohydrate, that's clearly wrong. A normal person needs about 110 to 140 grams of carbohydrate a day to live. So for anyone who's suffering from type 2 diabetes, the first thing you'd have to tell them is, listen, you have to take that kind of carbohydrate first. If not, you're not healthy. So you need that kind of carbohydrate first, and then after that, you need to limit that once you achieve the daily amount.
Okay. So the daily amount you're talking about is not a huge amount, though. It's like a one serving a day. Is that
well,
right?
just to give you an example, a 60 gram of carbohydrate is about your normal bowl of rice. So, and that's pure carbohydrate. So if you eat 2 bowls of rice, you're really hitting your limit. Yeah, you're really there. So you're right. It's not a lot, but I need to cut out the carbohydrate completely is clearly wrong.
Yeah.
Why would people want to cut it out?
I think, well, there's been a lot of things going about carbohydrate. Carbohydrate has been seen to be the enemy nowadays. There's some diets which link it to weight gain. Some people say, oh, it's going to cause your sugars to go up and so forth. But I think it's important to know there are different forms of carbohydrate there.
Okay.
And perhaps what we should be telling the public is not that carbohydrates are bad for you. And yes, it's definitely linked to obesity and so forth, but rather we have to eat the correct type of carbohydrate.
So what would be the correct type of carbohydrates for someone with type 2 diabetes?
Well, first of all, you are allowed the bad carbohydrate. Yes, you can eat the rice and so forth. Yes, you can have the occasional ice cream. There is no such thing as a diabetic diet.
Okay.
However, that being said, some replacements are necessary. If you can, rather than eating your normal white bread, change it with whole grain, brown rice, eat more whole grain, anything with more fiber. That sort of carbohydrate is a lot better.
Less processed foods.
Yes, and less simple forms of carbohydrate. And I think the biggest challenge we have in diabetes is that, first of all, there's the element of diet that's involved, and obviously that promotes insulin resistance and obesity. However, the problem we have is not only in the diet aspect, but the treatment of diabetes as well. Because a lot of the treatments that we give for diabetes also promote weight gain. A lot of the old treatments that we have, I'm sure you've heard of insulin before, medications like glitazones or TZDs. On one hand, they lower glucose. However, on the other hand, one of the side effects that they have is promote weight gain. And so on one aspect, you have a good thing, you get the glucose down in the type 2 diabetic. However, on the other hand, they gain weight. And the problem with the excess weight gain is that promotes insulin resistance, and to simply put, in a person with type 2 diabetes, you just don't have enough insulin to go around. Therefore, the bigger you are, the more insulin you need. So the more medicine you take...
Sounds like a cycle.
It is a vicious cycle. It is a vicious, and it's pretty scary at the end of the day when you think about it. So the latest therapies that we have in diabetes over the last few years have been focusing more on weight neutrality or weight loss. And there's been a new drug that's come out in Singapore this year called the SGLT2 inhibitors, or dapagliflozin or Forxiga. And what it does is it actually promotes weight loss on top of glucose reduction, and that's important.
Well, certainly exercise has to be part of the regimen as well, right? What kind of exercises do you think would help? Are there certain ones that would be more efficient?
No. Simply put, I think you just need to start moving. Long and short of the story. The more you exercise, the more sugar you burn up. So if you start exercising, whether it's anaerobic, where you lift weights, or when you're starting to run, all of these burn energy up. So I think it's probably the intensity of the exercise and the duration of exercise is a lot more important than the type of exercise that you do.
Help us understand the difference between type 1 and type 2 diabetes. Type 2, I understand that 90% of all cases are type 2, but type 1 is considered more genetic, less lifestyle related. So would carbs Would you apply the same rules for someone with type 1 diabetes when it comes to carb intake?
No. First of all, the genetic preponderance of type 2 is actually is stronger than in type 1 patients.
Right,
So if you have a mom or a dad who has type 2 diabetes, you have more likelihood of getting type 2 diabetes than type 1.
Okay.
That's the first thing. In type 1 diabetes, simply put, you don't have insulin. There's no secretion of insulin at all. So when you eat any form of carbohydrate, any form of sugar at all, you have no insulin response. In other words, your sugars just continue to climb and climb and climb, and it becomes toxic. In type 2 diabetes, you have an insulin response. It's just slowed or insufficient. In other words, when you take carbohydrate, your insulin levels do go up, but they just don't go up enough. So what happens is your sugars remain high for a period of time. So for a type 1 patient, to answer your question, whenever you eat carbohydrate, the only treatment you have in type 1 is you have to match it with the correct amount of insulin. In other words, if you eat, for instance, 30 grams of carbohydrate, we will teach our type 1 patients, listen, 30 grams is about 3 units of insulin, so you have to inject 3 units of insulin to match that particular meal.
Okay.
With type 2 diabetes, is it age specific, or is there like an age that's more susceptible to it? And does it get more difficult as you get older?
Yes, unfortunately. Think of type 2 diabetes as your inability to metabolize glucose. So over time, our bodies age, our ability to metabolize a lot of things start to decrease, so same with sugar. So as we get older, our body gets more insulin resistance, our insulin level starts to fall, so the risk of diabetes starts to climb over that period of time.
Are there anything you can do to kind of prevent it or mitigate those symptoms?
Well, simply, I think we've spoken about healthy eating. I think that's very, very important. It's a pinnacle of diabetes treatment, and exercise as well. These are simple things we can do, like exercising 30 minutes 5 times a week. That burns up sufficient energy, that gets your glucose down, that gets your muscles moving, controlling the diet, keeping the weight down, simple things like that, and that's very, very efficient in the early stages of diabetes.
What are you finding is like the biggest inhibitor for people to get over the hurdle or to break the cycle that they're in when it comes to sort of their diet and carbohydrates?
I think the biggest thing is whenever any patient asks me the same question, one is something you have to accept. If you tell someone, I think you don't need a doctor or anyone around to really see what healthy living is about. You eat better, you exercise more. However, I think the threshold for many people is different. Some people say, yes, doctor, no problem. I'm going to do this 5 times, 6 times a week, and I'm going to put in an hour of exercise, going to eat well. On the other person who's busy, who's reluctant to do that, I think you have to be prepared for that. I don't think that everybody is as motivated as we like to be, and I think that there has to be some form of balance between what that person is willing to accept and willing to do, and more importantly, sustain.
Do you find a lot of people that are type 2 diabetic don't take it seriously, don't take the risks seriously? Absolutely.
I think the problem is that, simply put, if you have high sugars and you have type 2 diabetes now, you're not going to see any problems until 15 years from now. So you have no symptoms, you feel perfectly fine, and the question I'm constantly asked is, why am I on so many medications? I feel okay, and these medications have side effects as well. So I think it's very important to choose the correct diet, the correct lifestyle, and the correct medication.
So I guess one of the big challenges is that people get so ingrained into like they've done these things for so long, and then now you're telling them they have a problem, and they've always eaten that way, always had 2 bowls of rice at lunch, always had carbs for dinner as well, that kind of thing.
Yeah, and I think the challenge really is I think it's going to be very hard. Someone walks in the doctor's room, and if they say, I'm sorry, you can't take the 2 bowls of rice anymore, that's pretty difficult. So I think perhaps the way I like to do it is say, all right, listen, if you really have to have the rice, is there a chance we can change it to brown rice, for instance, perhaps not take so much, and to see whether that's acceptable. Some people say, no, I'm afraid I have to take the 2 bowls. Then we have to find some other ways of trying to sort the problem out.
Acceptance is definitely the first way.
Yeah, absolutely.
Thank you so much for coming in this morning, Doctor.
My pleasure.
Dr. Ben Ng there on the carbohydrate connection to type 2 diabetes.